Good evening everyone and welcome to today's session. Prasoon Vaidya, top 10 videos, CG, Lovepreet, Shweta, Nagreddy sir, and everybody. January 3rd, we say day after tomorrow is my warring day. And you guys are going on a mission like Air Force pilots to go and do the bombing on the NEETPG exam, right? So I enjoy to be your Air Chief Marshal to be with you until the boys and girls go for a fight on the war. So Nidhi, Rishita and many more who are all online. Can you please punch whether the voice is loud and clear? Sorry that I got a bit late, but I will give you some latest questions which are going to be sure shot coming in the tomorrow's exam. Can you please punch whether the voice is loud and clear for everybody? So FMGE, Foreign Medical Graduate Exam, MCI screening test. Don't think it is an easy exam, doctor. There are easy questions, but there are questions which help you to do the soul searching. Life is Good is asking, sir, is your first son studying medicine? No, never. He's a college dropout. He's an entrepreneur and he runs a startup called Incus, which is once more a marketplace for anybody can become a teacher and can deliver a lecture. Even the parents who are teaching their children in the home, they can be able to live broadcast and other parents can subscribe at a throwaway price, 100 rupees, 50 rupees. They can be able to subscribe to those video lectures. That is the Incus, which is the marketplace. So if you have a passion to teach, please let us know. You get an opportunity to teach anything to anyone, anywhere in the world, and be able to make a good earning out of that on the Incus. Now, doctor, neural crest cell migration is because of. Let us take up the FMGE 2018. Punch your answers, doctor. Hyaluronan is required for the cranial neural crest cells migration is what you need to remember. Which is the derivative of ultimobranchial body. Who is going to give me the correct answer, doctor? Yes, we will really go fast. No worries. Question number 2. Keep punching your answers. Ultimobranchial body is the one which gives rise to parafollicular cells. Absolutely right. Rahul Khanna. So, doctor, the fourth branchial pouch, as I told you, definitely one question is going to come on the branchial arch derivatives. Without that, there is no NEETPG exam. Now only take a chance to do the quick revision, right? So from the fourth pouch comes the superior parathyroid glands and the ultimobranchial body. Ultimobranchial body incorporates into thyroid gland and it gives rise to the parafollicular C cells is what you need to remember. What is the derivative of Ratkey's pouch, doctor? It is the Craniopharyngioma, which is the derivative. So, doctor, tomorrow examiner will give a question. A supracellular tumor which shows the presence of calcification. You should be in a dominating position to recognize that it is typically the gross appearance of the craniopharyngioma, which is a very prospective image-based MCQ in the tomorrow's NEETPG. Coracoid process of the scapula. What type of epiphysis? Types of epiphysis, types of joints. Favorite question, doctor. Pivot joint, all types of joints. You have to be very sure. Very good. Sarah Khan says intraparenchymal calcification and supracellular location, classical of craniopharyngioma. Very good. Nagredi sahab bol rahe atavistic. Lakshmi also. Most of you, it is atavistic epiphysis. Fadafat bola doctor. What is a pressure epiphysis? Typically, it helps in the formation of a joint, like the head of the humerus and lower end of the radius. Traction epiphysis, it provides attachment to the tendons of muscles. Atavistic epiphysis, they are phylogenetically independent but became fused in man, like the coracoid process of scapula. Aberrant epiphysis is not always there, like the head of the first metacarpal bone and the base of the other metacarpal bones. So pressure epiphysis is head of the femur, lower end of the radius. Traction epiphysis, trochanter of femur and tubercle of humerus. Atavistic epiphysis, coracoid process. Aberrant epiphysis, epiphysis of the head of the first of the metacarpal and at the basis of the other metacarpal bones is what you need to remember. So कल के एग्जाम में epiphysis आएगा और मुरली भरद्वाज याद आएगा. Now doctor, which is not a component of carpal tunnel. This is one of the favorite question, doctor. So now, do you all agree that MCI screening test question paper 300 MCQs are worthy to do the revision, because they are also from the NEET board and examiner is going to has shown a lot of commonness between NEETPG and FMGE. So, doctor, medial flexor digitorum superficialis and profundus. This is the most important illustration that should go into the mind, doctor. You have flexor carpi radialis, one separate compartment. Flexor pollicis longus, flexor digitorum superficialis and median nerve in one compartment. Even this is also a single liner MCQ. Please don't forget. Examiner will ask you, which tendon has a special room, VIP room? Flexor carpi radialis is what you should remember. Now, which structure passes to the Guyon's canal? So that Guyon's canal syndrome, where there's a compression. Punch your answer, doctor. So, I will be going fast, but you keep on punching your answer as a reinforcement, right? All these revision sessions are all a reinforcement. Excellent. Ulnar nerve. So the superficial sensory deep motor division of the ulnar nerve, typically it is while passing to the Guyon's canal is what you need to remember. A good number of times when the cubital tunnel syndrome is there, right? So same time Guyon's canal also get involved, which is typically called double crush. What is the most common nerve damaged in the leg, doctor? Beautiful question. Common peroneal nerve. Because it is more superficial and very close to the bone, so fractures involve it. Femoral triangle ka base is formed by what? Keep punching the answers. Very good. So it is the inguinal ligament. So doctor, femoral triangle, our good old days of anatomy. Superiorly inguinal ligament, laterally medial border of sartorius, medially medial border of adductor longus. Always this used to be a big confusion in the MBBS first year days. Laterally is the medial border of the sartorius, understandable. Medially is the medial border of the adductor longus. So adductor longus muscle also forms the floor of the triangle. And the apex is basically formed where the sartorius and adductor longus meet each other, is what you need to remember. The medial compartment of the thigh, punch your answer, is supplied by which nerve? Medial compartment. Obturator nerve is called the nerve of the medial compartment. Tell me the muscles of the medial compartment. Medial compartment may anterior division, posterior division of the obturator nerve supply. So, pectineus, gracilis, erector longus, erector brevis. Erector brevis is actually supplied by posterior division of obturator. If it is not supplied by the posterior division of the obturator, it will be supplied by the anterior division of the obturator. Then posterior division supplies obturator externus, adductor brevis, adductor magnus is what you have to ultimately remember. Iran Shah, good evening and welcome. First web space of the foot. Who is going to give me the correct answer, doctor? First web space of the foot is supplied by. If you correctly answer this question, doctor, anatomy में distinction मिल जाएगा. Question number 10. Now since this is the exam moment, I should not ideally give you this kind of bets, but no worries. Saeed Memon is saying deep peroneal nerve. Naveen is betting on superficial peroneal nerve. Shweta Jha from Nepal is also saying superficial peroneal nerve, but clean bowl. Saeed Menon, Jindabad. Right? Very good. So, doctor, be very sure. One question tomorrow NEETPG में आएगा. You will definitely say, अरे sir, बहुत अच्छा session attend करने से हुआ. Doctor, the posterior tibial nerve, it provides the sensation to heel and also to the medial and lateral sole of the foot. Medial, lateral sole of the foot and the heel is tibial nerve. अब भूलेगा नहीं. Right? Next. Medial plantar nerve is the one which typically supplies this area. This area is all medial plantar nerve. Lateral plantar nerve supplies this area. Saphenous nerve provides sensation to the medial foot. Sural nerve in this area, right? Sural nerve to the lateral foot. And the web space, okay, the web space between the big toe and the second one is by the deep peroneal nerve in the first dorsal web space is what you need to basically remember. Okay, then the dorsum of the foot excluding the first web space is all supplied by the superficial peroneal nerve. Then anteromedial part of the foot is by saphenous nerve. Sural nerve provides sensation to the lateral foot is what you need to remember. You'll promise me you will not do a mistake in this question, right, doctor? Very good, very good. Gagan Kuber, MCH is proposing, sir, hand में first web space is a solo area of radial nerve. Excellent. So, doctor, which structure is not found in superior mediastinum? Biscuit question. Pulmonary trunk, thymus, arch of aorta, they are all found in superior mediastinum, which extends between T1 to T4 is what you should remember. Then you have anterior mediastinum, middle mediastinum, posterior mediastinum. Agree, doc? Now, which is true about a bronchopulmonary segment? MCI screening test. MCI screening test. Come on, punch your answer, doctor. यही क्वेश्चन आएगा कल के एग्जाम में. Bronchopulmonary segments, Cunard classification of the liver. You have to be 100% sure, doctor. There is no way you can't do it wrong. Arun is giving 5 D's. पूरा चाकू निकाल के डी में चला रहे अरुण बाबू जिंदाबाद. Very good. That should be the spirit. You should give a frontal attack to the examiner. हमला करना है, defense नहीं खेलना. So pulmonary veins are intersegmental. So the pulmonary vein is intersegmental in the connective tissue, and you have the segmental bronchiole and the pulmonary artery, which constitute the bronchopulmonary segments. Left anterior descending is also called widow's artery. It is the branch of the left coronary artery. Once more, doctor. Coronary circulation. What is marginal artery? What is similarly venous drainage? Great cardiac vein, middle cardiac vein. देख रहे हैं इतना छोटा इश्यूज हैं, मगर नहीं पढ़े तो सत्यानाश हो जाएगा कल के एग्जाम में. बी वेरी श्योर, प्लीज डू द रिव्यू. हाँ भैया, एग्जामिनर पूछ रहे हैं ये क्या है बोल के. दिस स्ट्रक्चर व्हिच इज बीइंग सप्लाइड, दिस वन, आई मीन लेबल्ड ए. This once more proves this is a MCQ screening test question. Third part of duodenum. मगर इस क्वेश्चन का बड़ा भैया नीट पीजी क्वेश्चन बैंक में बैठा हुआ है. कल के एग्जामिनर क्या पूछेगा? Relationships of the first part, second part, third part, fourth part of the duodenum, anterior, posterior. You have to be very sure. एक बार रिव्यू करेंगे क्या? चलो. Doctor, this is the first part. What is the length of first part? 5 centimeters. Second part 7.5. Third part 10 centimeters. Fourth part 2.5 centimeters. That is the reason examiner कल क्या पूछेगा? Longest of the 4 parts of the duodenum. What is your answer? Third part. Got it? And what level of vertebra? L1 से शुरू होके L1 to L3 में हमारा duodenum is extended, vertical extension. Please remember. Now, if you take the relations of the first part, anterior relations में first part को quadrate lobe of the liver, gallbladder. This is the first part of the duodenum. Here you have the gastroduodenal artery, the head of the pancreas, the hepatic artery, foramen epiploica. These are all located, and this is the portal vein. बराबर? Anterior relations. First part के पीछे क्या है? पीछे है you can see the gastroduodenal artery, the bile duct, portal vein, superior mesenteric vein. They're all passing behind it, and common hepatic artery. Similarly, if you look at the second part, the gallbladder is very close to that, the right lobe of the liver, transverse colon, transverse mesocolon, and coils of small intestine, and they're all anterior to duodenum second part. Whereas posterior to second part of the duodenum is the kidney. Barabar? Right renal vessels, right edge of the IVC, and right psoas major, aorta, inferior vena cava, वगैरह. Third part of the duodenum, what do you have? Which is the longest part? Sorry, fourth part. So typically you have transverse colon, transverse mesocolon. I mean, this is actually the third part, not fourth part. Third part. So these are the issues for the examiner, doctor. Be very sure about it. Now, very good. Gagan Kuber adds a very good point. Very interesting point. That is in fact my very favorite point also. This is liver, doctor. Esophagus, intestine, then you are having the small intestine. So small intestine से क्या निकलेगा? Mesenteric vein. यहाँ से क्या आएगा? Splenic vein. Splenic vein. Together what do they form? Portal vein. Portal vein supplies the liver, and from the liver the entire drainage will go into hepatic vein, and from there it will go into inferior vena cava. What Professor Gadan Kuber MS MCH is telling is the liver may caudate lobe is the one which directly drains into the IVC instead of depending on the hepatic vein for its drainage. Entire liver drains into hepatic vein. Caudate lobe is spared from hepatic venous drainage. Is what you need to basically you should remember. So that is the reason whenever hepatic vein occlusion is there, what do you call it as? What do you call it as? Burchieri syndrome. The entire liver become blocked from draining. So everything drains into caudate lobe. From caudate lobe it drains into the IVC. Hence caudate lobe hypertrophy is one of the cardinal features of Burchieri syndrome is what you need to remember. Got it now? Now doctor. Cords of Billroth in spleen, where do you find them, doctor? Red pulp. Typically in the red pulp there will be splenic sinuses separated by the splenic cords of Billroth is what you need to understand. Very good to see 101 online students on this historical day of January 3rd. Please also tell your classmates to join. Once more night 11 o'clock to 1 a.m. I will give you a very good company so that you go to sleep with some content. Oh, yes, I studied 2 hours bulking. No tension, no anxiety if you are there with Dr. Murli Bharadwaj. The only way to not feel tense, anxious is to study. That's the only thing that we can do. Action. Action will help you to control the reaction. Okay? Now, what is the function of superior rectus muscle? Doctor, this definitely aane wala question hai. Extraocular muscle actions is the favorite topic of the examiner. इसके पहले भी हमने डिस्कस किया अध्यक्ष महोदय, अभी भी डिस्कस करेंगे कल के एग्जाम के लिए. चलो, what is the mnemonic? Oblique का स्पेलिंग में L है ना. Obliques cause lateral rotation of the eyeball. Obviously, if obliques cause lateral rotation, what should recti cause? Medial rotation. Only medial rotation. Nothing else. Only medial rotation. All obliques cause only lateral rotation. You'll remember, right? Now, ऑब्लिक का नाम के ऑपोजिट में उनका काम होता है. नाम एक होता मगर काम दूसरा होता ऑब्लिक्स का, राइट? सो सुपीरियर ऑब्लिक विल डिप्रेस द ग्लोब. इंफीरियर ऑब्लिक नाम इंफीरियर है बट इट विल लीड टू एलिवेशन, बट इट लीड्स टू एलिवेशन. Whereas recti rightly fit their name. That means lateral rectus will abduct, medial rectus will adduct, superior rectus will elevate, inferior rectus will depress. Rectus, according to their name, they behave. Superiors are intorters, inferiors are extorters. Okay? Now, fatafat bolo. Superior, that's the reason what it should do. Intorters. And it is a rectus. Rectus means It will do according to its name. Superior rectus means it lead to elevation. Then what else? Obliques are lateral rotators. Recti are medial rotator. Medial rotator means adductor. Again, that's right. Yes, got it? Now, the nerve which is passing through the cavernous sinus. Cavernous sinus. Which one it is? Who is going to give me the correct answer? Question number 17. Fatafat bolo. Answer. निशा जी बोल रहे abducens. Rashi, clean ball, optic nerve. Come on, doctor. Can optic nerve can pass through cavernous sinus? Rashi, right away call our 9000868 9000868 our helpline number, and take a 3-day pass. Free 3-day pass into onlinembbs.com video library, and also become part of our WhatsApp study group. Optic nerve does not pass to the cavernous sinus, beta. So you have to be very sure. Oculomotor, trochlear, ophthalmic division of the 5th, maxillary division of the 5th cranial nerve, and abducens. They all pass through the cavernous sinus. इसलिए whenever cavernous sinus thrombosis is there, that lead to all these cranial nerve palsies is what you have to fundamentally appreciate. Sharif Saab, our WhatsApp people will respond. Don't worry, our only mission is to be with you, doctor. Just WhatsApp them, 9000868 You can even text them, right? But they will take little time to give you an activation to the online MBBS video library because there is a different guy who will do the activation. That's the reason. Okay? They will add in the group. We want more and more. Bring all your classmates also. We will add them in the WhatsApp study group. No worries. The blood supply of the abdominal part of the esophagus. Which one it is? Should you answer, doctor? Very good. Gagan Kuber rightly says, Tolasa-Hunt syndrome involves the apex of the orbit, and it is a granulation. Yeah? Now, you should remember, left gastric artery, inferior phrenic nerve, they supply the abdominal part of the esophagus. So, doctor, esophagus एक long tube है. So, इसलिए the esophageal branches of the right bronchial artery, aortic esophageal branches, then when the esophagus enter into the abdomen, that is the place where the left gastric artery branches will basically supply it. So, cervical part of the esophagus supplied by inferior thyroid artery. This is the favorite question of the examiner. Right? Definitely आएगा कल के एग्जाम में. Inferior thyroid artery. Then thoracic part is supplied by bronchial esophageal branches of the descending aorta. Abdominal part is supplied by ascending branches of the left phrenic and left gastric arteries. Here's what you have to basically remember. Yes. Our helpline. The people who are sitting on our helpline, they had been my employees for the past 10 years. Somebody joins for employment with me will never leave. They love to stay with Dr. Murali Bharadwaj. And they are such a committed soldiers. Even midnight also they will go extra mile to help a student who requires a help. So that is the reason, no worries, doctor. We are all with you. You will get activated. Now, Shweta is asking, sir, which nerve is involved in congenital talipes equinovarus? Ammo. I'm not very sure. You have answers, Shweta? Please let me know. Good question, but what is the skin over the parotid supplied by? What is a very important rule you should remember, doctor, when it comes to the innervation? Sensory supply of the entire face is supplied by trigeminal. The only exception is skin overlying the angle of mandible, that is overlying the parotid. That is supplied by great auricular nerve. Similarly, all muscles of the facial expression, seventh nerve. The only exception, levator palpebrae superioris, which is supplied by third cranial nerve. So third cranial nerve palsy, you get ptosis. That's what you need to remember. So the area which is overlying the skin overlying the parotid is the one which is supplied by the great auricular nerve. Deepest nucleus of the cerebellum. Which one, doctor? Fastigial nucleus. Bulb of the penisca. Blood supply kya hota hai, doctor? Question number 21. Who is going to give me the answer? Bulb of the penis blood supply. Question number 21. Now, yeah, so Nayomani is saying bulbo-cavernous artery. Almost reached Nayomani. I'm only seeing Collector Sahiba Nayomani, IAS, because yesterday you promised to go for civil services after joining MS Anatomy. So I will remember, doctor, next 50 years also, I will remember. I have an exceptional memory for people and their promises. So, bulbourethral artery. So, doctor, the bulbourethral artery, it runs to the deep transverse perineal muscle. It supplies corpus spongiosum, bulbar urethra and bulbourethral gland of Cowper is what you need to remember. Cremastric muscle, what is the nerve supply? Genital branch of the genitofemoral nerve. Now, which artery is supplying the endometrium? It is called spiral artery. So, if you look at the vascular anatomy, typically the blood supply to the endometrial basalis, it is called spiral artery, which is the nerve which is supplying great toe and second toe. Come on, who is going to give me the correct answer? Deep peroneal nerve, just before we discussed. The area around the umbilicus is supplied by T10 is the dermatome, which you should not forget. So, typically nerves T7 to T9, they supply the skin from xiphoid process to just above umbilicus. T10 supplies around umbilicus, T11, T12 and L1 supply from umbilicus up to pubic area is what you should remember. Retraction of the scapula is by which fibers? Come on, who is going to give me the correct answer? We will give a distinction. Professor Gagan Kuber Saab, aap sabko yaad dila rahe, nipple line is supplied by T4. T4 for that matter, doctor, favorite MCQ. Lot of things occur at the level of the T4. So that is the reason, कुछ भी नहीं याद आ रहा है और आंसर्स में T4 है तो jump and answer it in the dermatomes, right? I mean in the anatomical levels. So doctor, Ajay Maurya is proposing A, Suresh middle, Nisha middle, Gautam middle, salute. Middle fibers of trapezius. The superior fibers, which are descending fibers, they elevate the scapula. Middle fibers, they are the ones which retract the scapula. That means they will pull it posteriorly. Then ascending fibers, they depress the scapula and lower the shoulder. That is what you have to be very sure on the trapezius. Now, doctor, hyperthermia in adults, malignant hyperthermia. It is the calcium channels, L-type channels in the T-tubule, ryanodine receptor, you should not forget, which plays a very important role in exocytosis. Easiest question, biscuit question, calcium is what you need to remember. The moment action potential depolarize the axon terminal. There is a depolarization of the voltage gated calcium channels. Calcium triggers exocytosis of the synaptic vesicle contents. So what is meant by what is that syndrome? Opposite of myasthenia gravis, Eaton-Lambert. Eaton-Lambert, you have antibodies against this voltage gated calcium channels which are located in the presynaptic membrane. Presynaptic membrane. What is the favorite MCQ of the examiner, doctor? Difference between Lambert-Eaton and myasthenia gravis. In which case you have areflexia, in which case you have normal deep tendon reflexes. Fatafat bolo. Myasthenia gravis, normal deep tendon reflexes, because it is typically located postsynaptically. But the Lambert-Eaton, the sodium channels are all presynaptically located. So that is the reason they are like a continuation of nerve. Nerve is a part of element. That is the reason there is a areflexia. Areflexia is a feature of Lambert-Eaton. Normal deep tendon reflexes are classically seen in myasthenia gravis. कल के एग्जाम में definitely पूछेगा एग्जामिनर. Dense bodies are found in the smooth muscle. Smooth muscle में dense bodies, where are they found? जो skeletal muscle में होता है, smooth muscle में नहीं होता है. जहां आपको dense bodies मिलेगा, कहां? It is Z line. So you should remember, smooth muscles are not striated. They have no sarcomeres. Then they have caveolae, which are indentation of sarcolemma, which will act like T-tubules. And they have dense bodies instead of Z-line, Z-disc. That's what you need to remember. So dense bodies are the counterpart of the Z-disc in smooth muscle is what you should remember. Once more, doctor. Very traditional question. Smooth muscle, skeletal muscle, contraction is the favorite topic, doctor. If you have done this question, little shaky lag raha hai to immediately go back to the onlinemmbbs.com video library and do a revision of smooth muscle, skeletal muscle, favorite area. Now, doctor, which is not a molecular motor, dynein, kinesin, myosin, they are all molecular motors. What is the function of antiporter? एक अंदर लेता एक बाहर फेंकता. One molecule goes in, other molecule goes out, that is antiporter. SGLT1, typically where do you see? It is the secondary active transport of the glucose in intestine. So typically in the bowel lumen, you have this GLUT5 receptors. Then you have the SGLT1 receptor that will help in the secondary active transport of the glucose and into the intestine is what you need to remember. Right, doc? Now, please drop a line in all your WhatsApp study groups so that others also can join the session, doctor. I think night 11 o'clock is the favorite time. That time 200, 220 students come. But today morning I got up and I have seen 1600 views are there. Oh my God, I thought. Maybe students wake up early in the morning and do the revision. Right? Now, maximum smooth muscle as compared to wall thickness. Which one? Out of all this, come on, who is going to give me the correct answer? Question number 33. Fatafat bolo, doctor. Fatafat bolo. Pneumonia, absolutely right, doctor. Terminal bronchiole. 3 single liners, you should remember. Entire respiratory tract is supplied by pseudostratified tall columnar ciliated epithelial cells. Pseudostratified tall columnar ciliated epithelial cells, except the vocal cords. Vocal cords, what is the type of epithelium? Stratified squamous epithelium. एक MCQ आ गया ना? No. Second, bronchioles do not have cartilage. Bronchioles do not have submucosal glands, unlike bronchi. Second MCQ आ गया ना? Third, terminal bronchiole contain maximum smooth muscle relative to the wall thickness is what you need to remember. So doctor, once more I want to tell you, in the onlinembbs.com, every video is accompanied by a PPT, and we have 2 lakh PowerPoint slides like this. You don't need any other notes. You can always take a screenshot, whatever that you feel is a good slide for the last moment revision, right? You have that wonderful provision on the onlinembbs.com video library, okay? And there are 1,000 hours of video lectures, totally around 3,000 video lectures, and 30,000 MCQs topic-wise classified from 6 question banks: AIMS, All India, PGI, JIPR, FMGE, DNB, and you can tell your juniors every day across the year. We have a 2 hours of live online broadcast. Of course, it is free, but we remove the video and then make it archived into the onlinembbs.com video library. Okay, doctor? So, Arun is saying, sir, WhatsApp not reachable. Can you give a call? You can give directly a call. Our helpline is very much on and alive. 900868 No worries. Now, during a 100-meter sprint, from where will you get the energy, doctor? You get the energy from phosphocreatinine. Yes, sir. Call not going. Arun, have you paid your Airtel bill? Call should go, doctor. Should go. Right? Now, co-lipase is an enzyme found in. It is found in pancreatic juice. Pancreatic juice is having lipases, ribonucleases, proteolytic enzymes, amylase, elastase, esterase, etc., etc. Now, the blood levels of 125 dihydroxycholecalciferol. Okay, 1 minute, doctor. Since you have asked it, I will ask our helpline. I will check whether our helpline is. So it is saying we are having so many calls suddenly, doctor. So today, after we said 3-day free pass, lot of students are requesting quickly to activate their account on the online MBBS. That's the reason it may be engaged. So just please take a little time. Have a bit of patience. Yeah. Madam, the students are complaining that you are not taking the call. Arun and a few more, please take the call and give them an activation, okay? Yeah, I told doctor. I told before you only. Now, you should remember, it is parathormone. Parathormone reduces the phosphate. What is the effect of parathormone on the renal phosphate reabsorption? It decreases. It will make more phosphate lost into urine. It leads to phosphaturia. Which one? Parathormone. And parathormone stimulates 1-alpha hydroxylase. It has a positive effect on 1-alpha hydroxylase. 1-alpha hydroxylase converts more and more 25-hydroxy into dihydroxy vitamin D, right? So that typically will, that is called positive effect feedback effect is what you need to remember. Now, doctor, stretch stimulus is mediated by muscle spindle. I told you ना, definitely कल के एग्जाम में भी यही होता. Golgi tendon organ 1A, 1B, 2B, extrafusal, intrafusal. नींद से जागो मेरे प्यारे भारतवासियों, अगर नहीं पढ़े तो पढ़ना है, क्योंकि विदाउट ए क्वेश्चन ऑन muscle spindle, Golgi tendon organ, stretch reflexes, there is no question paper. So go back to the onlinembbs.com video library, just half an hour. अगर आप revision करें तो more than enough, doctor. Only half an hour video with a beautiful PowerPoint is available for you, just waiting for you, right? Now vitamin K, gamma carboxylation of the 2, 7, 9, 10 of the glutamic acid residues is the classical mechanism of action of vitamin K. Where do you see gluconeogenesis? Who is the mother? माँ भूख लग रही है, मुझे खाना चाहिए. 2 मिनट बेटा, अभी ग्लूकोज बना के खिलाऊंगा. लिवर बोलेगा. So gluconeogenesis mainly in the liver, but even kidney, small intestine also it can occur. And what are the 3 irreversible steps of the glycolysis, doctor, which are overcome by the gluconeogenesis? Hexokinase, phosphofructokinase, pyruvate kinase. These steps are bypassed in gluconeogenesis is what you need to remember. Now, doctor, glucose 6-phosphate dehydrogenase deficiency. What does it cause? It causes hemolytic anemia. All of you know very well. Lac-operon is an inducer. So, lac inducer for the gene expression. अभी आ गया डॉक्टर मेरा वाला क्वेश्चन, फेवरेट क्वेश्चन. मैं और एक बार आपको बोल रहा हूं, विदाउट ए क्वेश्चन ऑन डीएनए पॉलीमरेज, अगर नीट पीजी है तो मेरा नाम बदल दूंगा. ठीक है? सो वंस मोर, आप संडे एग्जाम के बाद बाहर आके बोलेगा, अरे सर डीएनए पॉलीमरेज है बोल के बोलेगा. ये वीडियो रहेगा. Right? So, come on doctor, what is your answer? If you have done this question wrong, doctor, please go back to the onlinembbs.com video library and quickly review half an hour video, right? Before you finish one South Indian filter coffee, you are done with it. Now, right. सारा खान बहुत अच्छा बात बोल रहे. वन सब करता है, वन सब करता है, बढ़िया. सो डॉक्टर, डीएनए पॉलीमरेज 3 का काम 3 to 5 एक्सोन्यूक्लियस, 5 to 3 एक्सोन्यूक्लियस. नाउ टेल मी डॉक्टर, डीएनए पॉलीमरेज 1, it has both 5 to 3, 3 to 5 एक्सोन्यूक्लियस एक्टिविटी, बराबर. नाउ filling, it will do the filling if the gap is there after removing the RNA primer. It also is capable of removing RNA primer. It can also do DNA repair. ये सब काम करने के लिए भगवान ने उसको बोथ 5 to 3, 3 to 5 दे दिया. DNA polymerase 2 जो है रिपेयर करता है DNA को 3 to 5. DNA polymerase 3 will do proofreading, editing, replication. इसको भी 3 to 5 दिया. खाली 1 को दिया 5 to 3. सारा को याद रखना. सारा क्या बोला? 1 सब करता है. That is the best way to remember. So 1 versus 2 versus 3. Whose polymerization rate is highest, doctor? 3. Processivity also is very high for 3. Proofreading 3 to 5, 5 to 3 exonucleus for 1, 3 to 5 for 2, 3 to 5 for 3. Primer removal best done by 1. Strand synthesis, only lagging strand is formed by the polymerase 1, right doc? Both the strands are synthesized by polymerase 3. इसलिए since lagging and leading strand both of them are formed, its replicative activity is very very high. That's the point you need to appreciate. DNA repair may main, who are the two main guys who will help in DNA repair? Pole 1, pole 2. बराबर? एक फुटबॉल ले लो, स्क्रीनशॉट, और कल के एग्जाम में जरूर आएगा. Now doctor, which is not a biological derivative of tyrosine? Melanin, epinephrine, dopamine, they're all formed from tyrosine. Creatinine के composition में क्या है? If you do this question wrong, no doctor, we should declare emergency. Come on, punch your answer. Question number 44. Yes, doctor. The composition of creatinine is, Abhishek is saying glycine, arginine, methionine, whatever, देखो, oh Jagadishwari, at least अभी समझ में आ गया ना, कल के एग्जाम में यही पूछेगा. क्रिएटिनिन में only one question comes, that is this: glycine, arginine, methionine, arginine, glycine, methionine. Why methionine? Methionine is S-adenosyl methionine, which is the donor of the methyl group. That's the point you need to remember. Now these are all branched chain amino acids: leucine, isoleucine, valine. They are all branched, not lysine. In case of cyanide poisoning, you give amyl nitrate. Barabar? So amyl nitrate क्या करेगा? Amyl nitrate methemoglobin तैयार करेगा. The methemoglobin will have a high affinity to bind with cyanide so that the regular hemoglobin is protected. That's a funda. So what is it an example of? It is an example of chemical antagonism. So chemical antagonism is an antagonism where the drug counters the effect of another with the help of a chemical reaction. So calcium sodium edetate, it forms a insoluble complex with arsenic and lead. That is a classical example of chemical antagonism. Then what is physiological antagonism? If two drugs have an opposite effect to each other, glucagon, insulin, glucagon sugar को बढ़ाएगा, insulin कम करेगा, that's called functional antagonism. Type 1 collagen के लिए you require vitamin C. Cyclic AMP is formed from ATP by the action of adenylate cyclase, which is an antioxidant. Vitamin E. Histidine to histamine, you require histamine decarboxylase. What is a very important vitamin for this reaction, doctor? Shoot your answer. Let me check how good you are. Ready? Abhishek, B9. Oh, no. Amreen, Munisa, vitamin D. Vitamin D. Oh, no, please, you do wrong, but don't do such a big wrong. Ashish Kumar, ये vitamin B9 क्या है भाई? हाँ? B6. Histidine become histamine by action of histidine decarboxylase. Pyridoxal phosphate, the vitamin B6, is the coenzyme of histidine decarboxylase, is what you should remember. देखा ना, vitamins के ऊपर कितने questions पूछ रहे हैं examiner? If you look at the list that I have given to you, 953 topics, PDF. If you don't have, please call our helpline 900868 Except for Arun Babu, everybody else, our helpline will pick up the phone. Arun, I hope our helpline picked up your phone, right? So 953 topics का PDF मिलेगा, 3 दिन free pass मिलेगा आपको to the entire online MBBS.com video library. And also you get included into our WhatsApp study group. So please call 9008683556 and get all these freebies. So in the list I have given you top 20 of biochemistry में first topic होता है vitamins. You have to be 100% sure. Antioxidant properties because of what? Dehydrogenation. Vitamin B12 is the only vitamin that has only animal source. That is what we need to remember. Now, doctor, I will download the PPT and 2 minutes I will be out of the broadcast. One minute, doctor. 2 minutes, 5 minutes, I will restart the broadcast because I have yet to receive the PPT. Okay, so within 5 minutes, I have another 60 questions I prepared to entertain you for about another 1 hour. So please be online. Okay, so 5 minutes, I restart the session. Please rejoin. Welcome back, doctor. Yes. The drug which is not given with ketoconazole is which one? So, ketoconazole basically is a inhibitor of P450. So, it can affect the metabolism of many other drugs. So there is a reason none of these are basically given together. That's what we should appreciate. So doctor, once more, P450 inducers inhibitors, a list जो है ना डॉक्टर, लास्ट एंड फाइनल बट्टी मार के छोड़ देना, ठीक है? हाँ, रिटोड्रिन, terbutaline, ritodrin, tocolytic agents होते हैं ना डॉक्टर? What are they? They are all beta-2 agonistic agents. Esmolol, why it is a short-acting beta blocker? Because there is a plasma esterase which will be drastically metabolizing the esmolol. That's the reason it is very short-acting. Pralidoxin, what does it do in organophosphate poisoning? It will reactivate the acetylcholinesterase enzyme, is what you need to remember. Now, morphine, What does it lead to? It leads to meiosis. Morphine लिए तो constipation होता है, decreases gastric emptying. Morphine should not be given to the person who has risk for respiratory depression because it itself lead to respiratory depression. What is the drug of choice for akathisia? Come on. Punch your answer, doctor. Who is going to give me the correct answer? Yes. Should be your answer. Drug of choice for akathisia. Tomorrow's exam, straight away this question is going to come. Yes. So, everyone is saying propranolol, absolutely right. So, whenever you are using a neuroleptic agent like haloperidol, there can be acute dystonia, akathisia, Parkinsonism, tardive dyskinesia, because all your neuroleptics, what will they do? They decrease the dopamine levels. Why do we get psychosis? Because of high dopamine. Neuroleptics will cause low dopamine. So, akathisia is that motor restlessness. For that we use anti-Parkinson's drugs, benzodiazepines, propranolol, etc. is what you need to remember. Thank you, Arun. I'm happy that they are attending your call. Now, the drug pyronaridine. Come on, doctor, let me. मैं अभी देखता हूँ आपका हिम्मत कैसा है. The drug pyronaridine. What is this drug? What is this drug? Come on, punch your answer. Question number 59. Correctly answer करे तो सीधा मिल जाएगा सीट. Arun Babu, you are a naughty Babu. Very good, very good. I am happy. Anti-malarial, absolutely. Arun Jindabad. Divya Kaur, excellent doctor. Pyronaridine. Honestly speaking, I don't know this drug, doctor. Only because of this class, I'm knowing this. Pyronaridine artesunate, the combination Pyramax, common drug name. It is an anti-malarial. It is one of the very common one combined with artesunate is what you should remember. And also, pyronaridine is considered to be a potential anti-cancer drug. This is what you need to remember. No doubt. What is the empirical drug of choice for the treatment of meningococcal meningitis? Ceftriaxone. Third generation cephalosporin, ceftriaxone, cefotaxime. They are the drug of choice for the management of meningococcal meningitis. CMV retinitis mein what do we use? We use foscarnet, ganciclovir, cidofovir, not acyclovir. Not acyclovir is what you should remember. How do you get the resistance to ciprofloxacin? Fundamentally, it is a mutation. It is a mutational multi-drug resistance responsible for the ciprofloxacin. Which amino glycoside is cochleotoxic? My favorite question in the water rounds. Come on, punch your answer. 63. Let me check how much you are ready with the standard questions, standard answers, no mistakes tolerated by the examiner and competition. Sarah Khan is saying kenomycin. Rakhendu is saying gentamicin. Chandra is thinking streptomycin. अरे वाह, कोई DV बोलो. Minocycline नहीं है क्या? Come on, punch. Habiba Sultana is saying streptomycin. Very good. Nisha Jindabad. Good. So, doctor, kenomycin, amikacin, neomycin, of course, dihydrostreptomycin. They are preferentially cochleotoxic, but classical means kenomycin. Okay, classical is kenomycin. Gentamicin is both cochlear vestibular. But most of the authors say gentamicin is vestibular only. Now, what are primarily vestibulotoxic? Streptomycin, tobramycin, netilmycin. तो अगर ये याद रखो नहीं तो वो याद रखो, दोनों को याद नहीं रखना. That's a minimum thing, right? So ऊपर का लिस्ट भूल जाओ, नीचे का जरा इजी लग रहा है. Streptomycin, tobramycin, netilmycin, vestibulotoxic. Victoria Station, Queen Victoria Station है ना कहाँ? कलकत्ता या बॉम्बे? Where do you have Victoria Station, doctor? So station STN. Yes, is streptomycin, tobramycin, and netilmycin. Victoria, old queen. उनको नहीं सुनाई देता, नहीं सुनाई नहीं. Vestibulotoxic, right? हाँ. Now, doctor, Pemetrexed. What is the mechanism of action? Kolkata. Acha. Good. So, doctor, Pemetrexed is an antifolate with multiple antifolate actions. It is an inhibitor of dihydrofolate reductase. Pemetrexed is used in chemotherapy. Alimta, it is a very good name for a startup. Alimta, like Yahoo, Ola, lot of times while it's very difficult to find a name for your company. So Alimta, so it is used in pleural mesothelioma. It is Pemetrexed. It has got multiple targets. It acts on thymidine synthetase, dihydrofolate reductase, and glycinamide ribonucleotide formyl transferase. Even that, on that also it will act. Folinic acid rescue is used for methotrexate toxicity. अच्छा भैया, ये फोलिनिक एसिड का बात हमको जरा क्लैरिटी देना. डॉक्टर, ये फोलेट है ना, folate become dihydrofolate by the action of dihydrofolate reductase. Dihydrofolate become tetrahydrofolate once more by the action of dihydrofolate reductase. And from where is this tetrahydrofolate is going? Its journey is towards forming N5N10 methylene tetrahydrofolate. N5N10 methylene tetrahydrofolate will help DUMP become DTMP and hence in nucleotide biosynthesis. If you give methotrexate, dihydrofolate reductase is inhibited. If dihydrofolate reductase is inhibited, N5N10 methylene tetrahydrofolate doesn't form. If it doesn't form, then DUMP cannot become TEMP. DTMP it cannot become. So that is the reason what you should do. If you give folic acid, no use, because methotrexate is stopping folic acid being utilized. So in methotrexate toxicity, you have to give folinic acid. What is folinic acid? Folinic acid is N5-formyl tetrahydrofolate. That will then directly will become N5N10 methylene tetrahydrofolate and it will bypass this reductase inhibition. So that is the whole idea behind using N5-formyl tetrahydrofolate in order to treat the methotrexate toxicity is what you should remember. So examiner 3 questions पूछेगा, 4 questions, 4 single liners. Methotrexate inhibits dihydrofolate reductase. Point number 1. Number 2, N5N10 methylene tetrahydrofolate is required for DUMP to become DTMP. That is another thing you should remember. Then what is the composition of the folinic acid? N5-formyl tetrahydrofolate. 3 points you should remember. इसका जवाब दे दो महर्षि, आपको नीट पीजी में गोल्ड मेडल दे देंगे. Jumfibragil, how does it act? Come on, punch your answer, doctor. मैंने बोला ना, hypolipidemic drugs, lipoproteins, apoproteins. एग्जामिनर के सर्वर में बैठ के हिल रहा है, आप अंदर जाते ही ऊपर गिरेगा. ऐसा क्वेश्चंस है, ऐसा टॉपिक्स है. You have to do a revision. Okay? Now tell me, doctor. Cholesterol absorption inhibitor. Amma. No, doctor. I will cry. Nagredi saab. जमफिब्राजिल. डॉक्टर साहब जमफिब्राजिल जिसको ट्राइग्लिसराइडीमिया है उसको देते ना, वो कैसे काम करेगा? अच्छा, पकड़ गया, सबका कान पकड़ गया. I am happy because you all did wrong. I am happy because you all did wrong. Jagadishwari जिंदाबाद. Absolutely. PPAR alpha activator. You should not do this question mistake, doctor. Once more, please go back to the onlinemmbbs.com video library. मैं तो मार्केटिंग एग्जीक्यूटिव से भी बेकार बन गया आपको बोल बोल के. onlinemmbbs.com वीडियो लाइब्रेरी में डॉक्टर बायोकेमिस्ट्री में अब भी जाके लाइपोप्रोटीन्स खत्म करो. फार्माकोलॉजी में जाके हाइपोलिपिडेमिक ड्रग्स का एक मर्तबा रिवीजन करो. Will you promise me? Yes. You are assured of 2 marks. So, doctor, typically PPAR. So, PPAR alpha agonist क्या है? Fibrates. Typically, they are used in hyperlipidemia. PPAR gamma agonists are thiazolidinediones. PPAR dual agonists, both alpha and gamma, are glitazars. They are used both for hyperlipidemia, hyperglycemia. Thiazolidinediones means pioglitazone, etc. Then PPAR gamma agonists, they are under investigation for obesity and cancer. कल के एग्जाम में ये क्वेश्चन आए तो व्हाट्सएप में मुझे लड्डू भेजना. Now, doctor, what are the mechanism of action of statins? Statin is a competitive inhibitor of FMGE reductase. Gilutone क्या होता है? Lipoxygenase inhibitor. Venlafaxine comes under which class of drug, doctor? Come on. इसके पहले भी बोला अध्यक्ष महोदय, हमारा देश बहुत मुश्किल सामना कर रहा है, इसलिए हम जरूर पढ़ना चाहिए एंटी डिप्रेसेंट्स का क्लासिफिकेशन. फटाफट बोलो. क्वेश्चन नंबर 69. लेट मी चेक. डॉक्टर बी स्पोर्टिव. इफ यू हैव डन रॉन्ग एंड मैं जरा आपको मजाक किए तो टेक इट इन अ पॉजिटिव स्पिरिट, राइट? बिकॉज दैट इज द होल पर्पस. दैट्स द होल पर्पस. There are so many videos available out. There is nothing more fun than live online interactive class. Tell all your juniors, East or West, Dr. Murali Bharadwaj is the only best companion for the preparation because हम भी आपके जैसे छात्र बन के, स्टूडेंट बन के रोज पढ़ाई करते हैं live online. And stimulate you to study. That is our USP, unique selling proposition. Now, doctor, let us take up this question. It is serotonergic, noradrenergic reuptake inhibitor. SNRI बोलते हैं. चलो, मेरे साथ और एक बार इसका स्मरण करो डॉक्टर. SSRIs, citalopram, escitalopram, fluoxetine, fluoxamine, paroxetine, sertraline. Then SRRs, duloxetine, venlafaxine, and milnacipram. Milna, kahin na kahin milnacipram. Then serotonin receptor antagonist, mirtazapine, Mirza Ghalib. Nefazodone, trazodone, bupropion, mianserine. Then MAO inhibitors, phenylazine, salicylene, trenylcypramine, meclobamide. You already know what are tricyclic antidepressants. Very good. Gagan Kuber साहब और एक बार याद दे रहे. Venlafaxine का साइड इफेक्ट हाइपरटेंशन भूलना नहीं, राइट? क्योंकि हमारा MS MCH डॉक्टर साहब बोल रहे गगन कुबेर जी. नाउ what leads to obesity? Insulin is lipogenic. Tropical pulmonary eosinophilia, we use DEC. वो तो छोटे बच्चा भी आंसर कर सकता है. ये बोलना डॉक्टर, नेफ्रोजेनिक डायबिटिस इंसिपिडस में what is the drug of choice? Diabetes insipidus means antidiuretic hormone काम नहीं कर रहे. It is leading to diuresis, right? ये डायूरेटिक स्टेट है ऑलरेडी. फिर भी इसके ट्रीटमेंट के लिए क्या इस्तेमाल करते? थाइजाइड. थाइजाइड इटसेल्फ इज अ डायूरेटिक. स्टिल वी यूज इट एज द ट्रीटमेंट ऑफ चॉइस फॉर नेफ्रोजेनिक डायबिटिस इंसिपिडस. There is a logic behind it. I once more don't repeat. Many times we discussed this. Please review the video on diabetes insipidus in the general medicine. Why thiazide? Though it is a diuretic, it is used in a diuretic state like diabetes insipidus. ये देखने के लिए कंपल्सरी आप Netflix पर NEETPG ऑनलाइन MBBS.com वीडियो लाइब्रेरी में एक बार डायबिटीज टॉपिक को रिव्यू सुनना. Similarly, Liddle syndrome, Bartter syndrome, Gitelman syndrome, right? Renal tubular acidosis. These are the 4 topics. Immediately you should go back to the online MBBS.com video library in the general medicine. Please do a revision. You'll promise me, right? हाँ. Now doctor, which is the iron chelator? Because और एक बार मैं बोल रहा हूँ डॉक्टर, अब भी बोल रहा हूँ, पेपर आउट है. Without a question on, at least one question on Liddle, Bartter, Gitelman, RTA, renal tubular acidosis. नहीं होगा NEETPG. Now doctor, iron chelator, deferoxamine is an iron chelator. Histamine का physiological antagonist क्या होता है डॉक्टर? Adrenaline. Physiological antagonist means what? It is having opposite action. So histamine का effect on smooth muscle जो होता है उसका opposite होता है epinephrine का. अगर histamine lead to vasoconstriction, this lead to dilatation, bronchodilation. Then that is what you need to remember. Now diabetic diarrhea में what is the drug of choice? देखा ना कितना beautiful MCQs है हमारे चाइना, यूक्रेन, कजाकिस्तान और रशिया के हमारे भाई इंडिया आने के बाद जो टेस्ट है ना, ब्यूटीफुल क्वेश्चंस है. कम ऑन, पंच योर आंसर डॉक्टर. प्रसून वैद्य, डुलॉक्सिटीन, क्लीन बोल, सारा खान, क्लोनिडिन, सारा खान जिंदाबाद. श्रवण, क्लीन बोल, clonidine, you should remember. So how do you manage diabetic diarrhea, doctor? Typically opiate antidiarrheals like loperamide, codeine you can use. Bile acid binders like cholestyramine, pancreatic enzyme supplements need to be given. Anti-secretory agents like octreotide, clonidine can be used in the treatment of diabetic diarrhea is what you need to remember. Okay doc, deal? Now कार्डियोजेनिक शॉक के लिए आप इस्तेमाल करेगा डोबिटामिन. मैंने क्या बोला? 0 ऑर्डर फर्स्ट ऑर्डर के बिना होता क्या पेपर? नहीं होता. सिमिलरली बायो अवेलेबिलिटी, वॉल्यूम ऑफ डिस्ट्रीब्यूशन, राइट? ये फार्माकोकाइनेटिक का जार्गन है ना डॉक्टर. मेंटेनेंस डोज, लोडिंग डोज, डेफिनेटली वन क्वेश्चन आएगा. Be very sure, right? So in the first order kinetics, area under the curve denotes, it helps you to calculate both the clearance and bioavailability. So doctor, what is bioavailability? It is the measure of the amount of the drug absorbed into systemic circulation. So what is the bioavailability of knowledge if you attend Dr. Murali Bharadwaj versus any other videos and apps, pops and all that? If it is a live online class, bioavailability, सीधा systemic circulation में चला जाता, right? So it is very high. The drug absorbed. So it is the area under the curve, concentration versus time का curve है ना, area under the curve will help you. So area under the curve oral divided by area under the curve IV will give you the bioavailability. That's what you need to understand. Now doctor, rolling of the leukocytes on the endothelial cells is mediated by selectins. Once more doctor. PICAM, ICAM, ILAM, selectins, integrins. This is called academic masturbation. You have to imagine, fantasize in order to get the orgasm in pathology. First 6 chapters is all full imagination only, right? So doctor, inflammation chapter जो है ना उसमें ये selectin, integrin, ILAMs, PICAMs, ICAMs, you can't afford to lose. Are you all ready with apoptosis? Any question on apoptosis, are you ready? Because without apoptosis there is no NEETPG paper, is what you should remember. Now doctor, it is selectin, not integrin. Not integrin, you should be very sure. So doctor, neutrophil has a CLI Lewis 10 modified glycoprotein. It has got a high affinity. E-selectin, P-selectin, they will enable it to basically undergo the rolling. Then tight binding is helped by ECOM1. And there is a diapedicis that will occur. That is the place where PICAM1 will help you. PICAM1. E-selectin, P-selectin will first help it to undergo adherence, then it will roll. Right? So that is what you should remember. Now doctor, liquefactive necrosis. Every FMGE का जून 2019 पेपर देखा ना, उसमें भी एक liquefactive necrosis है, दिसंबर में भी है और 2018 में भी है. स्टैंडर्ड वहां बैठ गया liquefactive necrosis एग्जामिनर के पास. That's what you should remember. हाँ, this is another very high yield area doctor. सेल साइकिल रहता है ना बाबूजी, G phase, S phase, G1 phase, M phase, then what are the checkpoints, what are the CDKs, एक बार पढ़ना, ठीक है? पैथोलॉजी में एक हाफ एन आवर लेक्चर अवेलेबल है ऑनलाइन MBBS.com के वीडियो लाइब्रेरी में. प्लीज टेक ए चांस टू रिवाइज. वेरी गुड. नया मनी, अरुण बाबू, they are all proposing G1S. So the activation of the transcripting factor P53 is very critical for the DNA damage checkpoints. Suppose the cell is normal, P53 levels are low. There is something called MDM2. MDM2 remove the P53 from the nucleus and leads to degradation of the proteasome. Normal cell में. So P53 levels are low. But once there is any DNA damage, that will lead to P53 to undergo phosphorylation and acetylation. And it will become active as a transcription factor. And activated P53, this activated P53 protein को MDM2 कुछ भी नहीं कर सकता. So that is a point you need to appreciate. So MDM2, how does it degrade the P53? It will lead to ubiquitination of P53. Ubiquitin को ले जाके stick करेगा P53 को. So P53, if it is active, it will activate the apoptosis. So that is the reason whenever there is any DNA damage, immediately how will the cell know that it need to undergo apoptosis? खुदकुशी करना है बोल के उसको कैसे मालूम पड़ेगा सुसाइड करना बोल के? It is the P53 which activated will provoke it to take the extreme step of committing suicide. So doctor, you have one G2 checkpoint, there is a spindle assembly checkpoint, there is a G0 restriction point where cyclin D1, CDK4, CDK6, E2F, they all basically work. Then there is one G1 checkpoint where G1 is going into S. So at this G1 S point you are having the P53. Definitely परसों एग्जाम में आएगा एक क्वेश्चन. So G checkpoint, there is a DNA damage. Whenever DNA damage is there, P53 become activated. That will typically stimulate CDK inhibitor, and that lead to CDK cyclin complex to become inactivated, and the cell will pause. हम Coco, when we play the Coco game, pass बोलते हैं. So cell will pause in the G1 and undergo apoptosis. Here's what you need to remember. Barabar, doctor. Now, hyaline globules. Where do you see hyaline globules? Typically in yolk sac tumor, hepatoblastoma, hepatocellular carcinoma. अब्बा, इतने चीजें हैं, क्या याद रखेगा आप? बहुत मुश्किल है, बहुत मुश्किल है ये सब चीजें याद रखना. बेटर छोड़ दो, don't worry about them, right? But anyway, one comment on hyaline. Intracellular hyaline, whenever conditions like multiple myeloma, where there is excessive reabsorption of plasma proteins, hyaline deposits will be found in the proximal tubular epithelial cell. Junker's degeneration means what? There is a hyaline degeneration of the rectus abdominal muscle. It's called Junker's degeneration in typhoid fever. Then Mallory's hyaline, what is it? It is the aggregation of intermediate filaments in hepatocytes in alcoholic liver injury. Nuclear or cytoplasmic hyaline inclusion, where do you see? Viral infections. Oh, is it frozen? Oh. 1 minute, doctor. 1 minute. I restart broadcast. Okay? Please stay online. Now, what are Russell's bodies? Right. Russell's bodies. Russell's bodies are excessive immunoglobulins and rough endoplasmic reticulum, which are typically seen in the case of the multiple myeloma. So, doctor, these are basically called hyaline bodies. Agar himmat hai to, ye sab yaad rakhna. Yolk sac tumor, adenoid cystic carcinoma, nasopharyngeal carcinoma, Kaposi, renal cell carcinoma. I don't want, Papa. I can't remember, Papa. Chodo. So last moment mein kaise rehna malum, doctor? You should little go lightweighted. Don't try to gorge. It's very difficult. Now, which is most common tumor of the superior vena cava syndrome, doctor? Where facial puffiness, shortness of breath, etc., etc. Always remember, lymphoma, lung cancer, any of them can lead to superior vena cava syndrome. But the most common tumor is the Pancoast tumor, right? So that is very, very important. So you get one lady who has superior vena cava syndrome as clinical presentation. Will you be happy if she has lymphoma or lung cancer? If it is lymphoma, if you give steroid melts, it will melt. Lymphoma like snow. So if you initiate steroid, if the SVC syndrome is because of lymphoma, it will melt, and by the time next day you are back on the rounds, no, that lady will be having a comfortable coffee. But if it is due to lung cancer, typically Pancoast tumor infiltrates into the superior vena cava while it is draining into the heart. So there the only treatment is intravascular stent lagake. You have to maintain the patency. That's the only way that you can be able to manage SVC obstruction in squamous cell carcinoma. Now most common cancer leading to death: prostate, breast necrosis, calcification. Where do you see? Abba. You remember, no? The other day we discussed lumen A, lumen B, different types of breast cancer according to what? ER positive, HER2 new positive, etc. You remember that table, right? Please remember, once more revise that. So it is the Comedo subtype of DC, ductal carcinoma in situ, which shows necrosis and calcification. So doctor, this is the gross appearance: Comedo type, cribriform type, solid type, micropapillary type, papillary type. There are the various types of ductal carcinoma in situ. In that, this Comedo type is considered an early stage of breast cancer. It will show central necrosis, which is an evidence of cell death and decay. But the good thing is, it does not spread beyond the breast ducts. Ductal carcinoma in situ. But overall, if you look at the biological behavior of the Comedo carcinoma type of ductal carcinoma, then it is more aggressive. It is of a higher grade and little more aggressive than the others. That's the reason you need to treat it a little more aggressively. That is the story of Comedo carcinoma. Mucosal melanosis with hematomatous polyps. Even a LKG student also will answer. Pure jagat. Neonatal lupus. How do you identify, doctor? Anti-Ro antibody. Anti-Ro का दूसरा नाम है SSA. SSA antibody. Rheumatoid arthritis is anemia of chronic inflammation. That's the reason you have normochromic, normocytic anemia. So how does erythropoiesis develop in fetus, doctor? Yolk sac, liver, then bone marrow. What is the cutoff point of WHO to call a non-pregnant female that she is anemic? 11 or 12? 12. To screen a lady with family history of thalassemia, what is the test you want to use? Nest-Roft test. Once more, thalassemia, sickle cell anemia, hereditary spherocytosis, one out of these three, examiner आपके पीछे पड़ेगा. So now doctor, Nest-Roft means what? Naked eye single tube red cell osmotic fragility test, where you will assess the osmotic fragility of RBCs in a single concentration of buffered saline visually without any spectrophotometer. That's called Nest-Roft. Is the one which is used in the case of the thalassemia. Now, what do you see in rheumatic arthritis, rheumatic heart disease? Heart में, easiest question. McCollum's block. Where do you see that? Left atrium. You see McCollum's block. Whipple's disease, Trophorema whippli. Outward expression of gene is called phenotype. ये पूरा 10+2 का क्वेश्चंस है. But let me tell you, एग्जाम में 300 क्वेश्चंस में you don't prepare and simply walk in also you can answer 50 questions. ऐसे क्वेश्चंस रहता. So tension ना को लेना. Now polygenic inheritance you see in familial hypercholesterolemia. LDL receptor deficiency रहता ना, polygenic inheritance. Once more, doctor. Once more. My job is like a grandma who reminds the grandchild who is going to LKG, right? In fact, that is the main role of any mentor or a coaching guru. You have to do. You have to carry your pregnancy, doctor. I am not going to carry. I am an obstetrician. You will deliver. I take the credit. Right? What will you do immediately? Hyperlipidemias. List रहता ना? Fredrickson's classification, which is autosomal dominant, which is X-linked recessive, which is etc. etc. You have to do a revision. Definitely one question आएगा. Now, doctor, hyaline deposits in alveolar wall. Where do you see? We see it in case of Sarah is asking a difficult question. What all have polygenic inheritance? Right now I don't have list, but that's a good question. Now, hyaline membrane disease. So typically these are the intra-alveolar hyaline membranes that you see in case of hyaline membrane disease, doctor. Glutaraldehyde is used for bronchoscope, proctoscope, endoscope, any scope, not thermometer. Thermometer को क्या इस्तेमाल करते हैं? Dettol, Savlon, Lysol. They are the ones which are typically used for thermometer. Once more, disinfectant sterilization. Nasty topic in microbiology, but in the top 20 topics में, it is dangling in 4th or 5th position. If you don't have that PDF, please call our helpline, doctor. It will pick up the phone of even Arun Babu also, 900868 and take that PDF and get a 3-day pass, free pass into onlineMBBS.com video library. Most potent disinfectant, sodium hypochlorite. Anaerobic non-acid fast bacillus is actinomyces. Doctor, actinomyces is anaerobic, Nocardia streptomyces is aerobic. Barabar? Now, Nocardia partially acid fast, but actinomyces, streptomyces are not acid fast. Barabar? Point number 3. Most actinomyces do not stain with HME stain. Actinomyces produce granules. That's what you need to remember. Now, doctor, which is a capnophilic bacteria? Cigarette pita hai, capnophilic bacteria. So, which is that bacteria? H. influenza. 2 bacteria are called capnophilic, doctor. B. Berkeley cigarette, Brucella abortus, H. influenza, CO2 pita hai. They require high amount of CO2 for their growth. Then psychrophilic means which grow between 0 to 20, mesophiles are 25 to 40, thermophiles are, they grow 55 to 80. So, Bacillus stereothermophilus is a thermophile. Germ tube test, where do you do, doctor? Wow, very good to see 118 online students, doctor. Thanks for joining the evening with Dr. Murali Bharadwaj. Once more, 11 p.m. to 1:30 a.m. हमको क्लास है. आपके साथियों को भी बोलो, हमको नींद नहीं आता, आपको भी सोने नहीं देते, क्योंकि नीट पीजी फीवर है. Right? So please tell your classmates also to join the session. night 11 p.m. to 1:30 a.m. right? कल जरा जल्दी सो जाएंगे, no worries. Tomorrow also you have a class at 3 p.m. to 5 p.m. We'll have interactive session. Night कितने बजे? 10 बजे 10 p.m. to 12 p.m. एक 200 लास्ट मिनट पल्ली पटानी क्वेश्चंस खत्म करके सो जाएंगे और डे आफ्टर टुमारो एग्जाम को जाएंगे, बराबर? हाँ, जर्म ट्यूब टेस्ट is Candida albicans. Candida albicans. Okay? Now, microsporum involves skin and hair. So, doctor, recognition of this dermatophytosis is important. Trichophyton is like cylinder, microsporum is like spindle, epidermophyton is like club. Microsporum involves skin and hair. Trichophyton all the three. Epidermophyton only skin and nails. Epidermophyton. Be very sure. Now doctor, अम्मो लाइफ इज गुड मुझे छोड़ेगा नहीं, एनबी मॉक टेस्ट का डिस्कशन नहीं करे तो करूंगा. आई जस्ट चेक दैट. नाउ pulmonary eosinophilia is seen in which infection? Filariasis. Which parasite lives in bladder plexus? Cystosoма. सबको मालूम है. Epithelioid cells are derived from macrophages. So granuloma is a nodular collection of epithelioid macrophages surrounded by a rim of lymphocytes. ये है lymphocytes. Epithelioid macrophages surrounded by a rim of lymphocytes. That's what you need to remember. Meningococcal meningitis is due to terminal complement component pathway deficiency. That means C5, 6, 7, 8. Now look, that brings us to the end of the 1 hour 45 minutes of our revision, doctor. Once more, let me tell you, only high energy, prepare your guns. Don't worry whether my ammunition is enough to fight or not. You have sufficient ammunition to fight the war day after tomorrow. Because common sense is first. Next comes the concepts, content and all that. Common sense, confidence, they are the only two things. So that's the reason you first feel yourself, I have sufficient ammunition. हम कितने शाम ऐसा चाय पे चर्चा करते हुए, भजन करते हुए रिवीजन किया ये पूरा 2019. Remember all those wonderful evenings, Sundays, grand test discussions that we all have sailed together. मुझे तो satisfaction है भैया, आपको भी रहना चाहिए, ठीक है? So once more we will all catch up at night 11 p.m. and try to do a revision of another 150 questions. Good night and once more see you in the evening.